Hello everyone. We all know that there is ongoing pandemic of COVID-19. Since it started, a lot of information is being circulated on internet, social media, and messaging apps like WhatsApp. It can be confusing to go through all this information. There is also danger of false information and myths. So let us simplify and understand what is COVID-19 pandemic all about and how can we stay safe. I am Dr. Gulrukh Hashmi, working as Assistant Professor in Department of Community Medicine at Vinayak Mission's Medical College, Kariakal, Pondicherry. I will give you an overview of prevention and protection against COVID-19. COVID-19 stands for Coronavirus Disease 2019. It is caused by a virus named SARS-CoV-2. This virus first appeared in Wuhan, China, and then spread all across the world. A person who is having COVID-19 may have fever, cough, body pain, pain in joints, loss of sense of smell, or loss of taste. The food will be tasteless for them. Some may have runny nose or loose motion or rash. In severe cases, there can be difficulty in breathing. Some people will not have anything. They will be healthy but still carry the virus in the body. These people are called asymptomatics. So how does COVID-19 virus spreads? If a person is having coronavirus in the body, when he coughs, sneezes, blows his nose or talks, small droplets are released from the mouth and nose. These droplets contain the virus. They land up on the hands, nearby objects, or they are in the air. So other person who is healthy, not having the virus in the body, when he breathes in this air or touches these contaminated surfaces, he may get the virus. The big question in everybody's mind is how to protect against COVID-19. Protection against COVID-19 is in our hands. We have to include small changes in our routines and behaviors. These changes are, first and foremost, frequent washing of hands with soap and water. Hands should be washed for at least 40 to 60 seconds. Especially after coming from public places, coughing, sneezing, blowing your nose, or when you are taking care of a person who is affected from coughing or sneezing or COVID-19 symptoms. If soap and water is not available, you can use alcohol-based sanitizers or wipes. Other thing that can be done to stop the spread of virus is use of tissue, paper or handkerchief to cover your face while coughing or sneezing or blowing your nose. After using the tissue paper, it has to be thrown into a closed dustbin. If you are not carrying the tissue paper or handkerchief, you can use your elbow to cover your mouth and nose. And remember, wash your hands immediately. Do not use sari or chunni or gamcha, dupatta to cover your face while coughing or sneezing. And remember, don't spit in public. These all will spread the contaminated droplets and cause the spread of COVID-19. Use of mask is absolutely necessary to reduce the spread of coronavirus. Mask should cover your nose as well as your mouth. You can use a homemade cloth mask. Before wearing the mask, wash your hands and use the strings to tie the mask, or you can use the loops. Always make sure that it fits properly and there are no gaps. You can use the mask for 6 to 8 hours. If it is dirty with secretions, you can remove the mask and use another one. Avoid touching the mask and do not pull it down. Don't remove it while talking, coughing, or sneezing. While removing the mask, do not touch the center area, but remove using the loops. If it is a single-use mask, you can dispose it in a closed dustbin. If it is a fabric mask, cloth mask, you can wash it. After removing the mask, also you have to wash your hands. One more important step that we can take is to stay at home unless absolutely necessary. When going for work, at workplace or in public place, maintain at least 6 feet distance from another person. Avoid gatherings and going to crowded places, parties, melas, etc. Remember, when you are going outside, two things are very, very important. That is the mask and social distancing. If you or someone you know have cough, fever, or difficulty in breathing, or you think that you are having COVID-19, then immediately contact the health authority and get tested. If the test report is positive, then depending on your severity of the symptoms, the treatment will be there. For those who are having mild disease, not much of a problem, then they can isolate themselves in the home in a well-ventilated room for 14 days. Wash your hands frequently with soap and water and use alcohol-based sanitizers or wipes. Always wear a face mask and maintain a distance of 6 feet from other family members so that the spread of coronavirus can be reduced. Maintain proper hygiene. Wipe with disinfectant the surfaces that you have touched, like the doorknobs, mobile phones, laptops, chairs, tables. Keep your utensils, clothes, towels separately and wash them separately. You have to monitor your temperature using a thermometer and oxygen level using a pulse oximeter. The pulse oximeter is a simple device which will be attached to your finger and it will give you the oxygen level in the body. Why we have to monitor the oxygen level is because in COVID-19, there can be happy hypoxia. That is, a person will have low oxygen levels in the body, but still will be feeling good. And ultimately, there will be difficulty in breathing. All those who came in contact with you in the past 14 days or those who are staying with you should also undergo testing and self-isolation. The person who is taking care of you, usually it will be our parents or brothers or sisters or wife or husband, they should also monitor their temperature and check for symptoms. They should follow hand hygiene and wear a mask while taking care of you. They should also self-isolate for at least 14 days, and if they are having any symptoms, they should get tested and call the health authorities. These are the simple measures that will help us to protect against coronavirus. All this information is available on the Ministry of Health and Family Welfare website and World Health Organization website. Still, there is a lot of information, misinformation, false information, and myths circulating on the internet and instant messaging groups like WhatsApp. Whatever information you get, please verify from your doctors, health authorities, or from the websites of Ministry of Health and Family Welfare and WHO. You must have come across the messages telling you about the cure of COVID-19, like garlic. Using garlic can increase your immunity, help your immunity, but it will not cure COVID-19. Inhalation of steam will help to reduce the congestion of the nose, but it will not cure COVID-19. Warm water, everyone should be hydrated, but it will not cure COVID-19. COVID-19 is a new virus and the research is still ongoing. Remember, majority of the people will have mild symptoms only. But this does not mean that we should take this disease lightly. Small changes in our daily routine, like frequent hand washing with soap and water, wearing masks, and social distancing, are proven methods to protect against COVID-19. Always remember, prevention is better than cure. Stay safe. Thank you.